Are you afraid to work on the diaphragm directly? I totally invite you to get unafraid of that. It's one of the biggest muscles we have. It's very much going to affect back pain, hip pain, and even shoulder and neck pain. So let's get you more comfortable working on it because we can really help your clients. So why is the diaphragm such an important big muscle to work on? Well, for one thing, it is a very big muscle. It actually takes up the entire part of your body here and separates all of your visceral organs from your heart and lungs. So it's a pretty big size muscle. The other reason is that it is one of the few muscles in the body that is both part of the autonomic nervous system and the somatic nervous system, right? Your heart is entirely part of the autonomic. You can't think your heart to stop, right? But you can consciously control your diaphragm, which is both good and bad. So a lot of us get very stuck in conscious control patterns of the diaphragm, and it gets stuck into a fight or flight pattern. So by working on the diaphragm and letting it release, you're going to allow all the other muscles to take back over the functions that the diaphragm may be compensating for. One of the things I talk about in our ribcage workshop is the fact that the diaphragm really should be a breathing muscle and not much else. But it can get recruited for postural support if other muscles are out of alignment and not really doing their jobs. And so by doing some work on the diaphragm and doing work on their breathing patterns, you're going to help the client's nervous system and brain recalibrate which muscles are doing what, so that postural and mobility muscles can do that, while breathing muscles like diaphragm and intercostals can do that, and they don't smear those functions across from each other. So the very first simple, basic contact way to release diaphragm is very simple and easy. I'm going to show it both the way that I do it in treatment, which is actually over the blanket and top sheet and through the blanket and top sheet. And then I'm going to undrape and have you see it just so that you can understand where the contacts are happening in the anatomy. But I do invite you to do this technique without having to undrape, because it does feel a little safer and easier that way. So basically, I'm going to palpate with my soft hand and find just her abdomen and place it very gently on the top, just so that she gets comfortable with something happening there. This is not meant to be a deep tissue at all. This is just a contact so that she gets used to having my hand in this area. Then I'm going to find her lowest ribs with my fingers and come just below those. I'm going to create a set of broad, stiff fingers here. And from back here, I can lean, trying to get equal pressure on both sides into the diaphragm itself. And I can just start out with that very simple contact, letting her breathe. As she inhales, her diaphragm presses into my fingers. As she exhales, it should lift away from them. And that can be helpful to explain to a client, because not everybody really thinks about how the diaphragm actually works. So Anne, as you inhale, I want you to think about pressing your diaphragm into my fingers as you inhale. And then as you exhale, just and try to let it lift away. That's nice. And as it lifts away, you can gently sink in a little deeper and follow it. This doesn't have to be a lot of pressure. In fact, a lot of pressure might terrify a client. A light pressure goes a long way. And once you feel it release, you can work a little bit more laterally towards the heads of the floating ribs and do the same thing. Breathe in, breathe out. Good. Breathe in to my fingers. As you exhale, they lift away. One more. Good. All right. And I do like to do a little bit of gentle rocking in between some of these techniques just to help their nervous system calm down. So that's how I would do it in treatment. But let's pull the drape away. We've got a chest drape in place already so that you can see it and see the anatomy a little bit more clearly. So is your chest drape secure, Anne?
Yes.
Good. All right, so we're gonna undrape down to her waist. And she has warned me that she has a couple small bruises from acupuncture. Those aren't from me. And so now you can already see the red marks of where my fingers contacted her through the blanket and the sheet. And that's partly the reason I like to do that, because even here, we've got a little bit of nail indentation, even all through the sheet. So doing it on bare skin is going to create even more contact with the nails. But again, here's her belly button, here's her lowest ribs, and I can come up and under, breathe out. Now I'm going to switch tools for a couple of reasons. One, I want to get the pads and less of the nails contacting. So a different way of contacting is the thumbs. Breathe out. Good. And I could do this through the sheets as well. Nice. And one thing I just noticed as I placed my hand here and rocked is that we have way more movement of the upper rib cage. As she's inhaling, we've got this nice expansion up there that really wasn't there before. So what that says to me is the diaphragm is much more willing to move with the breath. So now, those were all just contacting the muscle and letting its motion, because it has to keep breathing in order for her to live, right? So the motion of her inhale, exhale is already creating a pin and stretch effect without me having to do anything or tell her to do anything. But now we're gonna actually do a myofascial stroke up through the edge of the diaphragm. And again, in this contact we're making right below the rib cage, we're not getting into the main belly of the diaphragm. That would basically be impossible. You'd have to go way up into their viscera to do that. We're really just getting the attachments all along the lower rib cage, and that's fine. That's as good as we can do. So in this contact, we're going to basically be getting both the oblique attachments on the lower ribs and in the diaphragm up into there. So first, I'm just going to come out under here, again finding that lowest rib and seeing if she'll let me come a little bit under it. There. And now I've sunk in a little bit. I don't want to go super deep here. I'm just trying to get good fascial contact. And as it starts to slide, I can start to come up into that space towards the xiphoid process. And definitely as I get towards the xiphoid process, things are going to get zingy. Try to keep an eye on her breathing patterns as you're doing this kind of work. Take a look at her facial expressions. I notice she's really clenching her jaw right now. Can you gently let that open and rock open a little bit? There you go, that's a better exhale. And as I get towards the xiphoid, things are gonna get both like that 7-8 level feeling of achiness, but also just this kind of intensity that's hard to explain. Nice. And I'm going to come around and do the other side, because you never want to do just one side for this technique. On most people, the right side of the diaphragm will feel tighter than the left. It tends to be a little bit thicker, and there's a good reason for that. The right side of the diaphragm has the liver, which is this very big, heavy organ, attached to it by a ligament and hanging off of it. In addition to that, it has 3 lobes of lung on the top of it instead of just 2 like the left side. And so it can be a little thicker to hold that liver in place and tighter. And so you may need to spend a little bit more time on this side with this technique. It may feel stickier and less willing to open at first. And as you get up towards the xiphoid and start crossing into the top of rectus abdominis, things can get pretty interesting and intense and zingy. She's doing a really great job trying to breathe in a relaxed way. I don't get the impression that she's trying to force her breath to do anything in particular. Nice. Good job. It's always a good idea when you do intense work on a client to tell them that they've done a good job. So last but not least, I do, with a lot of clients, want to check in with what their breathing patterns are and what kind of control mechanisms they have. A lot of clients really force the breath to be long and deep and even on the exhale and the inhale in ways that are actually detrimental, and they're really not allowing the system to recalibrate itself and respond to either stress or a lack of stress. And so to help, a lot of times I will do contacts and talk them through very specific ways of interrupting their breath control. So the very first thing I want to talk about with a client is the fact that the inhale and the exhale are not actually meant to be equal. There's a lot of meditation techniques where they try to make them the same length. That's fine for learning meditation and for creating a vasovagal response and relaxing, but it's not actually how the breath normally works when we're just living our lives. In normal function, the inhale is a contraction of the diaphragm, and the exhale is a release of that contraction, right? Unlike, let's say, bicep, tricep, where you have an agonist and an antagonist, and one does something and then the opposite does the opposite thing. The diaphragm only has itself, right? It's the main muscle. Yes, the intercostals can assist with that and act in opposition as antagonists, but they're not very big or powerful. So instead of thinking of the inhale and the exhale as identical actions, I really would invite you to think of the inhale as an action and the exhale as a release of that action and a relaxation of that action. So the inhale is a contraction of a muscle and the exhale is letting go of that contraction. If you're making the exhale have the same length as the inhale, you're essentially eccentrically contracting the diaphragm all the way back up, which never fully releases the tension of it. So if I just come in, gently contact it, and I ask you to breathe slowly and deeply into my fingers, and then just let it all go. Good. And again, and let it all go. And again. Good. Nice. So that kind of full exhale where it's really, right, and it's not pushing the air out, it's really just letting the air out, like letting the air out of a balloon, will allow the diaphragm to really relax more, and in that in turn, once the client's brain understands what that feels like, will allow them to get out of fight or flight mode and get into rest and digest or parasympathetic mode. If you have a client where you're doing work here and they're just continually like controlling that exhale all the way down, that's a tension pattern, and I invite you to work with them, not at them or on them, but work with them to try and interrupt that pattern a little bit. So again, just breathing into it, let it go. So that's a basic version of that. And for some people, like Anne, that will be more than enough explanation to help her to release the diaphragm on the exhale like that. However, some people will still be stuck in a very controlled kind of breath. And so we can do a couple different things. So I'm going to show one more technique where I basically compress the belly towards the diaphragm. And what I'm going to have Anne do is take the deepest breath possible and then hold it as long as you can. Whenever you can no longer hold it, I want you to let it all go at once. And let it go. Nice. And we saw a really big, nice ribcage expansion and contraction. Try that one more time. Breathe in and hold it. And let it go. Good. Now what's happening with this hand is I'm pressing into the viscera. I'm not using lots and lots of force. But by compressing into the space, I'm actually stretching her diaphragm away from me. One more. Breathe in and let it all go. Good. Now you should feel that as a slight burny, stretchy feeling up in here. Is that true? So that's literally me pushing her viscera up into her diaphragm and using that to stretch her diaphragm muscle a little bit. You don't want to stay here forever, so I'll give her a couple more breaths. Now the one thing I like about what I'm seeing is as we're doing this work, her upper rib cage is really starting to open and move in the breath. For the most part, all of those different techniques will interrupt somebody's pattern enough for them to truly relax the diaphragm. But some people are still really, really into control. So the very last way I might try to interrupt that pattern would be again to contact here, but this time instead of this long hold, we're going to switch to rapid breathing. And so I want to do what's called breath of fire in yoga, where you just as long as you can. So go for it. Really fast. There we go. Now it's happening up in the rib cage. Nice. And whenever you can't do that anymore and it gets really tired, just let it go and just breathe. Good. Nice work. And now we really have that breath filling up the ribs and collapsing, which is actually how it should function. So we hope this video got you much more comfortable working on the diaphragm and helping your clients. But if you really need more guidance and would like to learn much more advanced techniques, we have a 2-day workshop here in New York City all about the rib cage and the breathing apparatus. It's worth 12 credits for New York State and any state that takes NCBTMB, massage therapy continuing education credits. And we offer it about twice a year, and you can find a link in the description below. In the meantime, please subscribe to our channel and like this video, and we think that you'll like this video too.